Right now, today's top stories from Des Moines news, traffic, and severe weather station. News Radio 1040 WHO. iHeartRadio. He knows that you care a whole lot more about your family and your job than you do about a bunch of politicians. Jeff Angelo is on News Radio 1040 WHO and the iHeartRadio app.
Partly cloudy skies, 11 degrees, 1036. Need to know with Jeff Angelo coming up at 11 o'clock, your 11 o'clock news. So here's a topic that Van, Bonnie, and I were talking about a little bit earlier in the week, and that was the announcement this week that Amazon is going to work with Berkshire Hathaway. That's Warren Buffett's company. That's how we know it here, being near Omaha. And JP Morgan Chase to create a company to offer affordable health care to their employees. But you know, if Amazon is involved, that maybe eventually something's going to happen to affect the insurance rates that you and I pay. So I want to ask a health insurance expert. So pleased to welcome to the Lippman Law Newsmaker line, Seth Denson. And Seth, welcome to WHO. I understand that you were struggling with a Jeopardy quiz as well.
Hey, Jeff, good morning. Thanks
Good morning.
for having me on. You know, I grew up, I live in Dallas, and I grew up with Tom Landry, I think, next to pictures of Jesus and Ronald Reagan in my house. So, you know, for the life of me, I didn't realize that he had perfected, you know, the deep staff and the shotgun and all that.
Exactly.
So I love learning, and I've learned something new today. I can call my father after this, and that's why I didn't know that.
And I would have been able to answer correctly because Tom Landry, you're exactly right. I didn't know that he perfected the shotgun. But if they said Tom Landry perfected this, I was like Dallas Cowboys. So, yeah, we've all learned something today.
That's right.
And let's learn something about health insurance. So I was really interested, Seth, after this announcement was made that Amazon, Berkshire Hathaway, JP Morgan Chase wanted to create a company and offer affordable health care to their employees, stocks of other health insurers tumbled. Now, was the market saying, look, we know eventually these guys are going to mess with us, right? What did you take from that?
You know, listen, anytime I look at what stock markets do, I'm always a bit skeptical, only just because the stock market, especially these larger corporations, oftentimes the stock ebbs and flows based on emotion. But, you know, what oftentimes we find is emotion carries on for a day or two, and then it rebounds quickly because, you know, those that are more in the know will see that they can buy things on sale. But what's interesting is they're still dropping, even through this morning. Yeah. Right? The only one that's seen a little bit of a rebound is Cigna, and we've been tracking CVS, Aetna, Cigna, United, and Anthem, which are the largest in the industry. And, you know, they've dropped on average 5.7%. That's just in those companies. Let's put this into perspective. That's over $30 billion in just a few days.
Wow.
That is gone. So I think there's something here, and I think it's because, listen, the health care industry, which let's make sure your listeners understand this. Health insurance is just health care financing. Mm-hmm. That's all it is, right? So as health care, the cost of health care continues to rise, guess what? Finance companies do really, really well. And that's why the insurance companies, which are finance companies, have done really well. That's why a couple weeks ago we heard that CVS is planning to buy Aetna, right? It's driving that steerage to the finance company. It's got these organizations like JP Morgan and Amazon and Berkshire Hathaway, which have nothing to do with the health care or health insurance space, say, hey, listen, something is wrong here. And we've all known that something is wrong, but nobody's stepping up to do anything about it. Mm-hmm. These guys step up and say something's wrong, and I loved how they announced it too. They were very careful about not saying we're going to be competitors. They said we're going to work together to fix our own organizations for our own employees' cost. Right? Brilliant, because that's their beta test.
Right.
If it works there, yeah, get ready, folks. It's going to change.
That's exactly what I thought. I appreciate you saying that, Seth, because Amazon, and you were right in saying that the markets always react to emotion. Amazon's a disruptor. Amazon has now gotten into the grocery store business, and they're beta testing a grocery store that you walk in and out, and you don't face a checker. So you're absolutely right that I would think that if you're in a health insurance company, you're thinking, look, they're gonna do this, and eventually they're gonna come out into the market, right?
That's right. Yeah, I mean, listen, there's a lot of hurdles that have to happen first. I mean, I was mentioning this to someone the other day that while healthcare is is mandated at a federal level thanks to the Affordable Care Act. It's been mandated at a federal level for years because of ERISA. And you got to understand that most Americans get their health insurance through their employer. And so the Department of Labor has always had their hand in employer-sponsored health care. Mm-hmm. However, it's still regulated at the state level. So we have a lot of challenges that have to be overcome if Amazon chooses, hey, we're getting into the healthcare space. They have to go get approved by each state department of insurance. They can't just come into Texas where I am or up in Iowa and say, hey, we're ready to do business. They have to go through the process of getting approved and how do they want to enter into the business. But listen, the power that they've got to aggregate data and to really move the needle from a negotiation standpoint, it's very powerful.
Well, and wow, you just set off ding, 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 a little bit of an alarm bell for me as a conservative, which is that conservatives have been pushing for years buy insurance across state lines. So let's say they do this beta test. Like you said, they've got to get approval, state. Wouldn't that create a powerful group of people, Berkshire Hathaway, JP Morgan Chase, Amazon, to go to Congress and say, we need to be able to offer this across state lines?
Absolutely would. And our firm has been advocating for the ability for insurance companies to operate across state lines for years, just because, I mean, competition is key in a capitalistic society, right? Mm-hmm. And so, you know, when I got into the insurance business, in 1999. There were 20-some-odd carriers here in Texas where I live. There's about 4 now. And when I say about 4, Texas is a big state. Some areas have more than others, right? So, but 4. So, listen, this is as close to a monopoly as we can get. And now what we're starting to see, and we saw this in what CVS is doing by purchasing Aetna, it is the industry itself is growing, and it's becoming more enclosed and controllable by those that have the most power. And that is a very, very scary thing as a consumer.
So let's talk about consumer impact, Seth, because the other part of the statement that was made earlier this week that drew my eyes was, well, we're going to try to remove the profit incentive in offering our employees health insurance. And I thought, how does that work? So, Seth, let me ask you the tough question. How does that work?
Yeah, so again, let's focus on the detail of what they said. This is specifically for their employees, right? So ERISA is very clear under the Department of Labor regulations that employers providing health care to their employees, it cannot be a profitable thing for them. They have a fiduciary responsibility to their employees when they are providing health care. And so that was a very easy statement for them to make that sounds really good as talking points, but in reality, those of us are sitting back, they're going, well, you couldn't have made money because it's just on your employees. That would have been illegal. So
sounded very charitable.
Exactly. Now, that said, there are organizations out there. We work a lot with a group out of Philadelphia called Pareto Captive Services. And what I believe that Amazon and Berkshire Hathaway and JP Morgan are doing here is they are doing what some employers have already started doing, which is let's just aggregate costs. Health insurance, again, being healthcare financing, is all about the long-term game. It's all about being able to take a large claim and spread it amongst the masses. And so there are organizations out there today that even your listeners can access if they're employers and they're providing health care, that they can go and they can access the market with others to spread risk and drive down costs. And these organizations oftentimes eliminate the profit margins that are built into the premium dollars. So the employers themselves have the ability to retain some of that underwriting profit that is typically reserved for the insurance company.
Well, what comes to my mind, and by the way, you're listening to health insurance expert Seth Denson at 15 minutes before 11 o'clock on WHO. What comes to mind is so many people email me about those cost-sharing programs that Christian organizations put together, Seth, which is we're figuring out how to spread out this risk. We're not interested actually in making a big profit. So you do have models out there, don't you?
We absolutely do. Listen, the first health insurance plan was actually that's really on record from history was here in my hometown of Dallas, where it was at Baylor Hospital. The nurses came together and said, let's all throw money into the pot, and if we have a problem, let's use that money to go help each other out when it comes to our health care. And so we've seen that expanded. The market options are available now. What I would tell your listeners, if they're in the decision-making aspect there, that if they're not being provided care plans, there's some good things out there. I put my parents in one of those. So here I am, an industry expert, and I was willing to put my parents into them. I believe that these things are good things.
But is it disruptive, though, Seth? It sounds good in practice. And, of course, if you're a health insurance company, you've got the actuary there, and he's writing down she's writing down the numbers and how that can work over the long term. In a MediShare program where somebody says, I have cancer, and suddenly becomes a big cost, that's a risk for a cost-sharing program, isn't it?
No doubt, which is why critical mass is critical, right?
Okay.
I didn't call it critical mass for nothing. I can't just go get 5 of my friends and do this. I need thousands upon thousands of lives, and there are actuarial tables that we have in our world that we look at. At what point is just to say it a different way, at what point is the crystal ball clear enough that I can predict the future of overall cost amongst the masses? Right?
Yeah.
And so once I hit that critical mass, it is pretty consistent. The data is out there to really understand that in this beta of a group that I am testing, I can forecast the future and the expenses over time.
So, Seth, I think you're where I'm at, which is, yes, this will be a beta test by Amazon and Chase and Berkshire Hathaway, but they'll look to move to the market someday with this, don't you think?
I do. I think that the beta test is going to prove that they're going to be able to retain a lot of the money that's walking out the door right now within their own organizations. And once they do that, they're going to go out and replicate it. The question was posed to me yesterday, so is it going to be a closed system? Are they going to have their own effective ecosystem? Well, then you start talking a little bit, sounds a lot like HMOs when you start doing that, right? They have to build out their own providers and hospitals and doctors. And don't get me wrong, these organizations are large enough they could do that. It takes a lot of time to do that, right?
Right.
And so, but their ability to go negotiate and create their own web of networks of existing providers is very powerful. You put that together with the technology backing that Amazon has, and you go to market with that could be a very powerful thing. And again, I think they're testing this. If it proves positive, and I believe that it will, get ready, folks. I think we're going to see something change over the next 5 years.
So, yeah, I think the bottom line, Seth, is you sound optimistic that the market could be developing something that's going to drive down my healthcare costs or my healthcare insurance costs.
That's right. Again, remember, and as I said at the beginning, health insurance, the driver of health insurance is healthcare itself. And so until we start driving down the actual cost of healthcare, listen, it's ridiculous that if I go spend an hour or two in a hospital, I'm spending 10 to 15 grand.
Right.
Right? That's absurd. And so this is the problem. And listen, we don't have enough time to go over it today. There are multiple reasons why that's the way it is. But until we start doing a better job of driving down healthcare costs, health insurance costs will continue to go up.
And we will talk about that in the future. I really appreciate your point of view, Seth Denson. I think you shed some light on a very important topic. Thanks for talking to me. We'll talk about healthcare costs in the future. Thanks for joining me today.
Hey, thanks for having me on. Appreciate it.
Absolutely. It is 10 minutes before 11 o'clock already. Need to Know with Jeff Angelo on News Radio 1040 WHO.